Yes, so good morning, everyone, and welcome to the 2050 Rural and Human Service Transportation Plans Regional Workshop, focusing on the Central Savannah River region. My name is Matthew Wilson. I serve as the Mobility Manager for the Georgia Department of Transportation and as the Project Manager for this plan. And I want to thank you all for attending today. Just a few virtual meeting housekeeping items. First, we ask that you please keep your mic on mute during the presentation. This ensures that everyone is able to hear the presentation clearly. For those using a computer or a smartphone, this is the microphone icon with a slash through it. For those on the phone, we ask that you please mute your phone. As we progress through the presentation, we have scheduled breaks for questions and discussion. Please ask or provide a comment. This workshop is designed for us to better understand rural and human service transportation in your region, and your active participation is encouraged. When asking a question or making a comment during these times, please use the raise hand feature in Teams. This is the icon with the smiley face and hand. Alternatively, you can use the chat box feature to type in your question, which is in the comment bubble icon. Our team member, Jaquita, will be monitoring the hand raises and the chat box during the entire workshop. If you are on a phone calling in, you will be unable to raise your hand or use the chat box feature, so please, during the discussion segments, we ask if anyone on the phone would like to speak, please unmute your phone and begin speaking. The 2050 Rural and Human Services Transportation Plan is a 3-agency plan. I will speak more about this in the coming slides. The Georgia Departments of Transportation, Human Services, and Community Health are the plan sponsors. The plan is being developed with the help of a consultant team comprised of AECOM, Cambridge Systematics, and Modern Mobility Partners. Today, we're going to run through the following topics. I will provide a brief introduction and some background on rural and human service transportation in Georgia. I will then hand it off to Will Brewer from AECOM to review the available transit and transportation services in the Central Savannah River region. After, Baird Breen from Cambridge Systematics will walk us through the region's transit needs, and then Kirsten Moat from Modern Mobility Partners will guide our discussion session. We will also have a couple question and discussion points throughout the workshop. So what exactly is rural and human service transportation? Not many people may be familiar with the terms. Rural and Human Services Transportation, or RHST, are mobility services provided for the benefit of disadvantaged populations, including persons with disabilities, older adults, and persons without a vehicle. RHST includes services provided by public transit operators, human service agencies, private providers, and private nonprofit agencies. This 2050 RHST plan seeks to do a few things. First, we're going to update the existing conditions information from the previous plan. Then we're going to build upon the recommendations and efforts completed from that first plan to identify projects, programs, and policies to meet current and future demands. This provides enhancements to the RHST services across Georgia. I mentioned that this plan is a 3-agency plan. This is because the state of Georgia administers 3 systems to provide public transit, human services transportation, and non-emergency medical transportation, or NEMT. Each system is administered by a different state agency using different funding sources. GDOT focuses on public transit for rural and small urban populations. DHS focuses on transportation services for seniors, low-income families, individuals with disabilities, and vocational training, while DCH focuses on transportation to medically necessary services for eligible Medicaid members. Coordination exists at the state, regional, and local levels. However, each agency system operates independently using a variety of service delivery models with differing requirements. The state's role in governing transit is primarily to oversee compliance with federal grant requirements. There is no single state authority to set priorities for public transit and human services transportation, or to coordinate planning and funding of transit services for rural communities. A little bit of history on the RHST plan. Back in 2007, the Georgia Departments of Human Services and Transportation completed the Coordinated Public Transit Human Services Transportation Plan. As an update to the plan, GDOT initiated the Georgia Rural and Human Services Transportation Plan 2.0 in 2011. The Plan 2.0 outlined coordination activities among the rural public and human services transportation providers across the state to achieve improved delivery service, for the state's public transportation and human services transportation customers. The plan also developed recommendations to implement mobility management at the state and regional level. In 2021, GDOT, DHS, and DCH began developing an update, the 2050 Georgia RHST plan. The purpose of this plan is to provide a framework for additional coordination among Georgia's agencies impacted by mobility services and continue the work of the Technical Coordinating Group, which is now renamed the Technical Advisory Group, and expand its participation to additional stakeholders. A quick look at our plan schedule. You will see we've wrapped up our vision and goals, which I will discuss on the next slide. And we are heavy into our existing conditions and needs assessment and beginning our alternatives analysis. What I want to focus on today is how to get people involved in this process and how we can get your input from your region to help us understand needs and develop solutions. The stars on the schedule indicate stakeholder and public outreach events. Those with the pink circle indicate the Technical Advisory Group meetings. Outreach is a key component of the RHST plan update and ensures the agencies updating the plan fully understand the rural and human service transportation needs across the state. The Technical Advisory Group, which includes the 3 state agencies sponsoring the plan, includes representatives from regional commissions, the statewide Independent Living Council of Georgia, and other stakeholders identified during our stakeholder engagement process. I'm pleased to see a few of them attending the workshop this morning. We are engaging stakeholders and the public in each of the 12 regions in Georgia through our regional workshops. And again, thank you so much for attending today. We are also conducting a statewide survey for RHST providers and a separate survey for riders. The link to which is on the QR code on the slide. These efforts will provide all Georgians an opportunity to assess the status of their RHST plan update and identify key needs and service coordination strategies. Additionally, public feedback will be elicited through the 30-day public review and comment period for the draft RHST plan update, which we are targeting for July. The RHST vision and goals are structured from the statewide transit plan. Our vision statement outlines where we would like rural and human service transportation to be in 2050, which is to continue and grow statewide rural and human service transportation coordination to improve the quality of life and economic activities for all Georgians, specifically those in rural areas, those with disabilities, older adults, and persons without vehicles. Our 6 goals, again based on the statewide transit plan, outline how we seek to implement the vision. The first goal is to provide coordinated and efficient rural and human services transportation. The second is to provide a safe and sustainable RHST network. The third is to optimize public transit programs to best meet public transit systems and travelers' needs. The fourth is to ensure public transit coverage across the state to support mobility and access for all. The fifth is to connect rural transit to regional and urban centers. And finally, the sixth is to leverage technology and innovation to support public transit ridership and performance. I would now like to hand it over to Will Brewer from AECOM to walk us through the available transit in the Central Savannah River region. Will?
Great. Thank you, Matt. And good morning, everyone. Thank you so much for attending. This really, won't be too extensive. I just want to provide a snapshot of your region and what kind of public transportation services exist. Not to mention, of course, Department of Human Services and Department of Community Health. Kind of just want to show you some of the services they're provided. So as you can see on our first 3 maps, we just want to take a brief snapshot of public transit within the region. I just would like to acknowledge in pink here, we have Augusta Richmond County Transit System, which includes demand response, 9 fixed routes, and paratransit. The majority of the region is demand response rural, so Burke County, Columbia County, Glasscock, Jefferson, Jenkins, Lincoln, McDuffie, Taliaferro, I probably did mispronounce that, Warren County, and Wilkes County. Washington County is one county in the region that does not have any current public transit services. In terms of DHS services, there are 3 parties that are involved: Division of Aging, Division of Family and Children Services, and Department of Behavioral Health and Developmental Disabilities. and that is covered throughout the entire region, as we see there. And lastly, with our non-emergency medical trips through DCH, those trips that will uh, get the rider to medical treatment, medical evaluations, obtaining prescription drugs, obtaining medical equipment, and so forth. There are 2 brokers that operate across the state in 5 different regions. Your region happens to fall within one of those regions, and that would be the East region. And that broker that provides those services for non-emergency medical would be Motive Care. And so really, we just want you all to see the existing conditions of your area and see where we may be missing something. So as I hand it back over to Kirsten, just keep in mind what we have here, and I think Kirsten's going to revisit these maps and go from there. So Kirsten.
Thanks, Will. Yeah, so again, we appreciate everybody joining today. So this is kind of our first scheduled break where we want to hear from you. We do have a polling exercise. So if you have a smartphone or a computer in front of you, you can log into menti.com, www.menti.com. And once you get there, it's going to prompt you to enter a code. There's an 8-digit code. It is 97922527. Alternatively, there's a QR code on the screen that you can take a snapshot with your phone, and it'll direct you to the poll. If you are unable to join the poll, that is fine. I'm going to ask some questions, and we will ask that you either raise your hand, or if you're on the phone, you may unmute yourself and respond verbally to the questions. So the first question, based on the maps that Will presented, and I'm going to go back to them in a minute, are we missing any transportation services? Is there anything on the map that is being shown incorrectly? Are there other maybe private transportation services that you're aware of that they're providing some sort of service, but it's not necessarily broken out into these 3 categories? That could be perhaps a church or a faith-based organization that's providing transportation to seniors, but they're using their own funding and maybe not Department of Human Services funding. So as you kind of think about that, I'm going to go back to the maps. So the first comment, church/faith-based band services, are these included? Unless they are being serviced by DHS, Department of Human Services funding, no, those types of services are not being shown on the map. And those are the ones that we would like more information about. Go back to the maps. And as Will pointed out, on the public transit side, most of the region is covered by rural on-demand service, with the exception of Richmond County, which provides rural and urban services, and Washington County, which does not have any public transit. Under the human services, this entire region, all 13 counties, does provide services for aging, Department of Family and Child Services, and behavioral health and developmental disabilities. So the entire region is covered by human services transportation. Similarly, the entire region is covered through the non-emergency medical transportation provided by the Department of Community Health. That is all administered through the Motive Care broker, and this entire region is in the Eastern DCH region. So I'm going to go back to the question. Any other transportation services we are missing, or any questions you may have about the existing transportation services? Are there any services for 16 to 18-year-olds for dual enrollment or apprenticeship site transportation? As far as I am aware, no, there is nothing specifically, there's no program specifically for youths to to transport to apprenticeship sites or for educational purposes. Matt, do you have anything additional about?
Yes, I wanted to sort of jump in. That's a great question and something that we have worked with our rural public transit operators to better serve, understanding workforce needs, both for the general workforce and for younger folks to get access to job training and other skills. And so there are ways in which we can partner with employers or with technical schools to offer those types of rides. It has to be a relationship between the local rural public transit operator and that entity. And we can definitely talk more about that as a follow-up. If you want to put your contact information in the chat box, we can get back to you. That's a great point, though.
Yes, that's great. Okay, I'm going to move on to the next question. So the next question is, thinking about the existing service that is out there today, from your perspective, either as a provider or maybe as a rider, what do you believe are some of the constraints on the existing system? So what we mean by this is perhaps there are certain days of the week that the services do not operate, or certain times of the day that they don't operate that perhaps would be beneficial. So I think, one of the examples that we've heard in other regions is that most transportation systems do not operate late into the evening or in the overnight hours, and therefore cannot accommodate third shift workers, especially in areas where you have high industrial and distribution and warehousing. Other constraints may be from a provider perspective that you don't have enough vehicles, or that the vehicles you do have are requiring more maintenance, and therefore they are out of commission or not available to provide services. Perhaps your constraint is that your front office is overloaded and you're having trouble scheduling all of the trips that are being requested over the phone. Another constraint may be labor pools. I think we're gonna talk a little bit more about this and what we've heard through the survey, but perhaps you're having a hard time retaining drivers. So any sort of constraint or issue that you're currently facing, and as a rider, maybe the constraint is that you want to ride transit, but you can't always do it because it's not available, or it's hard to book a ride, or it's easier to get a ride from a family or family member or friend. Okay, so first response is there is no weekend service, Saturday or Sunday, for Richmond County. Weekday service stops at 6 p.m. Some riders would like to participate in evening activities. So that's a great one. Employees or workers don't know that services are available in their area. So that gets to a constraint of education and how do you get the word out about the transportation services that are available in this area. Another constraint is the perception of rural transit. Potential riders may perceive that the buses are for the disabled and they're not for everybody. And I think that's a great point. And I think Baird is going to talk a little bit more about that and what we heard from the survey. So what other constraints? If you're not joining us through the Mentimeter and you would like to make a comment, you may do so by raising your hand or entering it into the chat box. If you're on the phone, just as a reminder, you may unmute yourself, and please feel free to speak up. Okay, excellent. This is not your only chance to make a comment during this call. We're going to have plenty of time at the end for additional questions, comments. We have some more questions for you. But this is the end of the polling session, so you can close out of your Mentimeter. We really appreciate your participation. These responses are recorded, and we're going to be documenting them as we go into identifying those projects, programs, and policies that Matt mentioned earlier to help address some of these constraints. So thank you. And now I'm going to turn it over to Mr. Barry Bream with Cambridge Systematics. He's going to give you an overview of some of the needs that we identified through a quantitative analysis of ridership in your area. So, Bear.
Hi, good morning, everyone. Thank you so much for your time today. As Kirsten said, we'd like to present some of our initial findings from the needs assessment that we conducted for this region for rural human services transportation, and help kind of set up the discussion for the latter half of this meeting. So the needs assessment that we used is based on the methodology that the GDOT used for its statewide transit plan in 2019 and 2020. And both methodologies are taken from a Transportation Cooperative Research Program report that offers this methodology as essentially a kind of nationwide strategy for analyzing demand. So we're pleased to be using this methodology. It's seen as very robust and very reliable. It's also allowing us to kind of make comparisons and do some lessons learned between our needs assessment for this plan update and, again, GDOT's previous statewide transit plan. Next slide, please. So the needs assessment is conducted through kind of two main analyses: a non-program demand assessment, which is shown on this slide in blue, and a mobility gap demand assessment, which is shown in this table in green. What these two methodologies do is produce an estimated level of rural transit demand, serving kind of a lower bound for the non-program demand assessment and an upper bound for the mobility gap demand assessment. That allows us to understand kind of a spectrum or range of demand within the region for rural and human services transportation. Both methodologies are based on demographic information taken at the county level, which allows us to understand a level of demand among populations that are likely to be transit reliant or transit dependent. So for the non-program demand assessment, this consists of demographics among people who are 60 and older, people with disabilities, and people who live in zero vehicle households, by which we mean a household in which the people who live there do not have consistent or reliable access to a private vehicle. The mobility gap demand assessment takes a similar approach, but focuses in a little bit more on the demographics of those people who live in zero vehicle households, and specifically analyzes travel behavior, essentially in how trips are taken, comparing those people in zero vehicle households to people who live in one vehicle households, as in people who live in households that do have ready access to a vehicle. So essentially, the mobility gap demand assessment attempts to estimate the difference in number of trips between those who have reliable access to a private vehicle and those who do not. This information is taken from the American Community Survey, which is a product of the U.S. Census Bureau. The data, the survey is conducted on an annual basis, but the data is released on a delayed schedule because of the necessary time needed to clean and process that data. So as a result, 2019 is the most recent set of data that we have available, and that therefore serves as our base year for this analysis. And we align that 2019 ACS data with the 2019 transit data taken from the National Transit Database reports that your agencies have to submit to the FTA. So that allows a kind of apples to apples comparison within 2019. We then use a horizon year of 2050 to estimate transit demand in the long run. And that transit demand for 2050 is also based on those demographic profiles. But for that, we use, or to estimate demand in 2050, rather, we adjust those demographic numbers using population projections produced by the Georgia Governor's Office of Planning and Budget, which produces estimates of population change on an annual basis for every county between 2020 and 2065. So what we see is that across all rural and human services transportation providers in the central Savannah River area, 208,000 trips were provided in 2019. Based on our analysis of rural and human services transit demand, we see a range of transit demand that varies from 124,000 under the non-program demand assessment, all the way up to 562,000 under the mobility gap demand assessment in 2019. What this means is that based on these demographic analyses, under the non-program demand method, the current transit providers are actually meeting all that demand. They're actually exceeding it by nearly 85,000 trips, which is great to see. However, we have the mobility gap demand assessment, which points to a higher level of demand based on travel behavior rather than travel demand, or I'm sorry, rather than demographics, which indicates an unmet rural trip demand of about 353,000. So again, this just indicates that there's a range of different possible demand based on how we analyze this. And in order to meet that level of demand, we have identified the total annual costs, both capital and operating costs, that would be necessary to meet 100% of rural demand. And that ranges from $2.2 million, which essentially captures the current operating costs and capital costs of transit service providers within this region, but then goes all the way up to 10.9 million, which again would cover 100% of that estimated rural transit demand of 560,000. Between 2019 and 2050, the central Savannah River area region is actually projected to lose population, and as a result, transit demand decreases between 2019 and 2050, declining slightly to about 113,000 trips under the non-program demand assessment, and declining to about 509,000 trips under the mobility gap demand assessment. This again means that the total annual cost to meet 100% of that demand, it's a little bit of a mixed bag. It increases slightly under the non-program demand assessment, which is really more due to a kind of rounding error, or I'm sorry, not a rounding error, a difference in rounding between 2.24 million and about 2.26 million. The projected total operating and capital costs to meet the mobility gap demand assessment declined slightly to 10.8 million. Now, again, those numbers may seem rather shocking, but it's not a recommendation for level of investment. This is essentially a maximal approach to estimate what level of investment would be necessary to meet 100% of estimated demand. So it helps us kind of understand the full scope of transit demand within the region. Next slide, please. We have an additional way of estimating transit demand that takes a slightly different approach from what was discussed in on the previous slide, and that's using the Commuter Transit Demand Assessment. The Commuter Transit Demand Assessment looks at transit in a slightly different way from what was discussed on the previous slide. The non-program demand and mobility gap demand assessment both look at transit demand as it is required for all types of demand within a county. And this is, both workforce transit or employment transit, but also shopping, running errands, going to the hospital, going to a doctor's appointment. The commuter transit demand assessment takes a slightly different approach and analyzes demand specifically to cross-county lines. This essentially recognizes the economic relationships between different counties within a region in order to kind of capture the fact that you have different distributions of residential areas and employment centers within counties, and therefore you're going to have some kind of flow back and forth between them. Here again, we're using an estimate of transit demand based on certain demographic behaviors, specifically the number of home-based work trips. This is used as a proxy estimate for transit demand because since these trips are taken essentially from home, people who work from home, they represent trips that are not being met by an existing mode of transportation. And so it's essentially a stand-in for potential transit estimate if people were to take those work-based trips and essentially bring them back into an office. Now, this home-based work trip is a combination of different data sources, including another U.S. Census database, but then also the GDOT travel demand model, which is a tool that GDOT uses to essentially analyze travel demand and travel behavior between counties. Now, we do recognize that every county is going to have some degree of flow between its surrounding counties because people live and work in all different areas. However, we set a threshold value of 100,000 commuter transit trips per year as a kind of minimum level of demand that's necessary to justify the costs of transit, those capital and operating costs that are necessary to sustain transit. And what we see is that there's pretty robust demand between Columbia and Richmond counties flowing in both directions, actually, which is interesting to see. There's about 1.8 million commuter transit trips demanded between going from Columbia to Richmond County in 2019, and about 300,000 trips going from Richmond to Columbia in 2019. And these corridors are expected to see growth based on the fact that they are expected to experience population growth and economic growth. And therefore, we see the transit demand increase by more than double in the case of the Columbia to Richmond, and by about 2/3 increase between Richmond and Columbia as that goes into 2050. So there's a pretty robust demand for transit in this region. I will pause there. We're going to continue discussing some of the qualitative feedback that we've identified, the qualitative needs that we've identified through some survey tools, but we've hit you with a lot of numbers. So I just want to pause for a minute and see if there are any questions on this methodology, on how we've presented any of the findings, just get some feedback from you all.
Yeah, so please feel free to raise your hand, enter questions into the comment box. If you're on the phone, you may unmute yourself. Just want to make sure there aren't any questions about this assessment, or if you want to go back and look at any of the numbers, be happy to do that. Jared, sounds like you explained it very well.
Thank you.
Okay, so again, we're going to have more time at the end, so be thinking about those questions. Be thinking about some comments that you want to make. This is going to be your opportunity to provide input into what we need to be looking at as a part of this study and the types of projects, programs, and policies that we want to recommend as a part of this. I think we did get one question. Chiquita, do you mind reading that question to us?
Sure. It is from Oliver, who says, did you consider date from the ARTS MTP 2050 plan. Or that could be ARTS MTP 2050 plan.
Yep, the regional transportation plan.
So we did conduct a review of all available transit development plans and metropolitan transportation plans in conducting this needs assessment. We didn't rely on data from the individual planning documents in order to, because in our review, we did see that some planning documents used different types of data or they analyzed it differently. And we wanted to use a consistent methodology across the state in order to just ensure that we were essentially working with the same types of questions, analyzing the data in a consistent manner so that we could compare across regions appropriately. But those MTPs and TDPs were very valuable in helping us understand some of the nuances within the regions, and recommendations from those plans will definitely be used to inform some of the recommendations that we develop through this study.
Okay, great. We'll keep the questions coming. Chiquita is monitoring the chat box, so if you want to enter your questions there, we'll pick them up once we get through the survey results. So Baird, I will let you continue with the qualitative.
All right, thank you very much. So yes, now we'll discuss some of the qualitative findings that we've seen. These are coming in from the provider survey and rider survey that Matt mentioned earlier. We've issued these surveys in order to hear from our stakeholders directly and understand the actual needs and priorities from the experience either of the service administrators in the provider survey or in the service users or potential users in the rider survey. So to start, as Matt mentioned, both surveys are still open. They're open through the end of the month. If you've taken the provider survey already, thank you so much. We really appreciate your input. If you have not taken it, the QR code is right there. We encourage you to take it. We encourage you to share it with your colleagues and your peers. We'd certainly love to get as many responses as possible on this. So what we've seen so far is we have 36 responses to date. We're very pleased with that level of response, but again, looking to grow it even more. What we've heard is that slightly fewer than 50% of respondents are able to carry riders to destinations outside jurisdictional boundaries. And about 66% of respondents have not pursued coordinated human services transportation or regional transit service. This is, something we see in a lot of in the rural transportation space. We recognize these are smaller agencies that may have limited administrative capacity to manage a lot of that inter-county service. Additionally, we see that agencies are in kind of a challenging place right now, with many agencies reporting less ridership in 2020 than in 2019. We had 6 respondents that indicated that they had fewer than 5,000 trips in 2019, but this increased to 10 for 2020. Obviously, this makes a lot of sense. COVID-19 had a lot of widespread impacts on travel behavior, travel demand, and tragically, even just the loss of life that occurred meant that there may be fewer people using rural and human services transit now than there was previously. But again, it helps us understand that these agencies are in kind of a rebuilding phase as they try to move forward and rebuild that ridership. To that end, we asked about challenges that agencies are experiencing, as well as how they're thinking about changing their service moving forward. One question touched on the technology that agencies either currently use or plan to use. And 2 respondents indicated that they currently use a smartphone app or website for trip planning and fare payment, but 8 agencies are considering adopting this tool. we're glad to see that. These kind of trip planning services, either through smartphones or websites, have definitely created a lot of value for customers, and it's great to see agencies are considering a more kind of technology-centered approach to helping their customers figure out their travel options. We also asked about state of good repair needs. The most common state of good repair need is purchasing new vehicles, which again, kind of a classic challenge for these agencies is just making sure that they've got, up-to-date vehicles. But the second highest challenge is establishing regular maintenance schedules, where we heard that a lot of these agencies actually share their maintenance staff with other transit providers or with county facilities or county municipal governments within their region. And as a result, they're not able to conduct their maintenance activities exactly when they want to, which influences their ability to have their vehicles ready to put back into service. We see that challenge as possibly related to COVID-19, because we did hear a lot of feedback from providers about the difficulties with attracting and retaining mechanics as well as drivers, which again we see as related to the workforce impacts of COVID-19, the great resignation that so many people talk about, where the workforce shortages and turnover in jobs have led a lot of people to change careers, to change positions, or just move out of the area. Interestingly, we've heard we heard in an earlier workshop that some transit providers are actually competing for drivers with fast food restaurants in their community, because those fast food restaurants have lost workers and so are increasing pay in order to attract people. And as a result, it's more competitive for people to stop driving and start serving burgers and fries. So it's a really widespread workforce shortage, and that's starting to cascade into our transit providers as well. We asked for people to indicate their most significant challenges in three main areas: administrative challenges, rider demand and satisfaction, and funding. And what we've heard is, again, this kind of mix of traditional, common rural and human services transportation issues, as well as some emerging issues that seem related to COVID-19. So for administrative challenges, we heard that there was issues complying with state and federal reporting, a very common issue in rural transportation, because again, you've got smaller agencies with smaller administrative staff that are still trying to provide that same level of response to meeting their federal and state reporting requirements. But then the other main administrative challenge, again, was that attracting and retaining qualified personnel. Among rider demand and satisfaction, the most significant challenges that we heard were expanding service into new markets and ensuring that transit can go to where their riders want to travel, but then also dealing with the public perception of transit, which is something we've already heard discussed earlier today. So it's great to see that consistency across our different inputs, essentially recognizing that people may think that rural transit isn't for them, that rural and human services transportation isn't going to meet their needs. But we also see the impacts of COVID-19 in this as well, because we recognize that people may not feel safe taking transit, that there's this perception that being in an enclosed space close to other people is dangerous to their health. So again, we recognize the challenge that we're trying to help agencies push through, the kind of marketing and branding challenge, as well as all these service challenges. And finally, the most significant challenge for funding was securing that local capital funding to make the capital investments, which again, very common in rural transportation. A lot of these small agencies are operating in small counties, with small municipal governments that are running very lean operations. and finding the funding for those larger, long-term investments can be difficult. So again, all of these are challenges that we're factoring into our thinking as we think about the recommendations that we'll build under this plan. If we can move to the next slide, we'll discuss the rider survey. Again, this survey is open to the public. All people are welcome to take it. We have the survey open through the end of the month, and we encourage you to share it with your constituents as well. We've received 55 responses to date, which is a good level of response. We're definitely pleased with that, but we are looking to grow the number of respondents because what we found is that 85% of our respondents do not currently ride transit. Obviously, that's very valuable for us. We want to understand why people may feel that they are unable to take transit or that they shouldn't take transit. It's not for them. Getting this sort of insight is really valuable to helping us kind of build that understanding and increase that awareness. But of course, we also want to ensure that we are hearing from our riders so that we understand how transit is serving their needs and where improvements can be made. So we'd definitely like to see more of a kind of 50-50 split between those two groups in the end. Among those who do ride transit, their main reason for riding is that they lack access to a vehicle, and their most common trip purposes are for work, medical appointments, and dialysis appointments. So we see that, transit is really providing a wide array of, or meeting a wide array of needs within the community, and it's meeting needs that can be extremely time sensitive. If transit were not available and riders had to find an alternative, they indicated that they would be able to get a ride from a friend or a family member. Again, that's something we see a lot of in rural transportation, that people take advantage of their social networks and tap those networks in order to try to secure mobility services. It's good to know that people have those options available, but those options aren't always seamless. They're not always consistent or reliable, and they have a cost. The people who do have access to a vehicle, aren't necessarily planning to always provide those trips to the people who do not have vehicles. So we want to ensure that rural and human services transportation is there as an option for those people who need it, that they can find more reliable and consistent service. Among those who do not ride transit, the two most common reasons for doing so is that they are interested, but transit is not convenient, or unfortunately, that they simply are not interested. Again, that might speak to some of those issues of perception and awareness, that people don't really understand how transit can be an asset to them, how it can meet a wide array of travel needs for them. And so we need to be thinking about how we do that communication and outreach. Among those who do use transit, the most frequently selected challenges for using that transit are that it does not go to where they want to go. The distance to the nearest transit service is too far, and it's not reliable enough for time-sensitive trips. Again, all of these are very common issues that we hear in rural and human services transportation. The reliability obviously speaks to the level of frequency and the timeliness that service can provide. And then the distance to the nearest transit service being too far or transit not going to where they need to go speaks to that issue of transit service coverage. Is the transit service able to get to all the critical locations for both picking up passengers and dropping them off? We asked them to indicate the transit improvements that they want to see, that they essentially where they want transit services to kind of focus their resources and energy. And what we heard is providing access to jobs, providing access to healthcare, and connecting different parts of the community or region. Again, demonstrating the need for transit to be in a lot of places and fulfill a lot of trip purposes and fulfill a lot of time-sensitive trip purposes. People have to get to their doctor's appointments on time. People have to get to their work on time. So thinking about that reliability and consistency in transit service will be really critical for helping ensure that the transit service is meaningful and valuable to folks. We also asked the survey respondents to indicate which transit technologies they want transit agencies to prioritize. And again, what we hear is making information available about that transit service, specifically real-time arrival information at transit stops and real-time arrival information available via smartphone, website, or text. So again, building in that consistency and reliability in transit service so that people have more information about when their transit service will be there, and using that information to plan their trips to ensure that their travel experience is as consistent as possible. So those are the survey findings that we have. Again, both surveys are still open. We encourage you, your peers, your colleagues, and your constituents to take it. We look forward to sharing the full results in our full report.
Thanks, Barrett. So that concludes the presentation portion of this workshop. We want to open it up for additional questions, comments. I mentioned that I have some more questions for you all. Just as a reminder, you can use your raise hand feature in Teams. You can also use the chat box or the comment bubble icon to enter your questions. If you are on the phone, you may unmute yourself if you have comments or questions that you would like to ask. If you raise your hand, then Jaquita will call on you and you can present your comment or question. So thinking about the service areas and connections, what other service needs do you have that we haven't identified? And are there missing connections either within your region or to other regions? So this could include things like maybe your transit service isn't able to travel across county boundaries. Do you have a need? Do your riders have a need to be crossing those county boundaries? I think we saw in Baird's presentation that there's a lot of cross-county transportation trips happening between Columbia and Richmond. But maybe there are some others. Maybe there are some struggles in, coordinating with your neighboring transit providers to transfer those riders. So anything like that you are struggling with, those are the things that we want to hear with regards to these questions. So I'm going to pause for a second. And while you continue to think about it, we will be taking additional questions and comments through March 4th, which is a week from this Friday. You can submit those via email to Matt Wilson or myself. We have our contact information on the last slide. You can also visit the GDOT Transit website, which we'll have a link to and we'll spell out. And you can find Matt's contact information there as well. I'm going to move on to another set of questions. But again, if you have responses to these questions or any follow-up, feel free to speak up, raise your hand. I know we've got a lot of people on this call, so really hoping to get some thoughts from you guys. This next set of questions, I've got 5 questions here, is really about coordinated service. So Central Savannah is a pretty large region, 13 counties, pretty large counties geographically. And there's a lot of different, at least on the public transit side, there's a lot of different operators. I'm sure on the DHS and the DCH, there's a lot of third-party operators that are involved in providing transportation services. So I'm curious, have you all discussed trying a coordinated service? If you have had those discussions, we would love to hear about it. If you are not interested in a coordinated service, we'd really like to hear what those challenges and barriers are from starting a coordinated service. So any thoughts?
Well, let me interject really quickly too, because we have, this is the best time for us to be able to get this information from you, which is, why these workshops are so important. I know that we've got a few callers on the phone, and then we've got some people, of course, who are watching us. So I don't want to pick on anybody, but if I have to, I will. I know we've got Dana Lynn McIntyre who's on the phone. We've got Debbie Jones. Um, Anybody?
Would call me out, Jaquetta.
You know I would. I know that name.
Okay, here's my question. I see Oliver Page down the list. Is that our Oliver Page from Augusta Transit?
I don't know. Oliver, chime in if that's you. Oliver says yes, that is him. He said that in the chat box. So any questions, comments? We really want to hear from you, because this information really helps us tremendously. And because we're all on this format, this is the best place for us to have the conversation. So even if it's a comment, or if it's something that you don't like, want to see improvement, here's the chance to chime in. Oliver, Dana?
I'm just wondering, from Oliver, workshops like this and information collected and questions asked, what can the Augusta Transit Department do with this information for itself moving forward?
It's a great question, Dana.
That's why I've been doing this so long.
So Oliver says, by
Yeah.
coordinated, are you thinking of one stop that would share information from all transportation providers? Again, by coordinated, are you thinking of a one-stop shop, basically, that would share information from all transportation providers?
That's a great question. So I'm going to answer Dana's first. What can transit providers do with the information that comes out of this? And I do want Matt to kind of chime in. Um, there is more funding coming from the federal government for transit. And so, we'll be coming up with project programs and policies. This is going to be an opportunity for transit providers to say, okay, here's what our needs are. Here's what's been outlined in the plan, and here's what we could potentially get funding for. So it's about finding ways to use this funding that's going to be the most beneficial to each of the regions.
I'd also say most of those kind of transit agencies don't deal with specific human service transportation needs. It's sort of a separate system in Georgia, and so sometimes we're having a coordinated system, meaning that you have an operator that does both the rural public transit, the DHS funded trips, and maybe sometimes the non-emergency medical trips. That provider doesn't know all the different types of needs in their service area. And so this plan can inform all different types of providers, the range of needs that exist, and could also increase that collaboration among those providers that provide those types of trips.
Yeah. And getting to Oliver's question about what does coordinated mean? Yes, it could be as simple as having a one-stop shop that is basically a repository of all of the transportation services that are provided in the county in one place so that anybody can access it. Coordination can also be what Matt just mentioned, where at the local level, transit operators and providers are providing services for public transit, for human services transportation, and in some cases, the non-emergency medical trips. On a broader scale, you can look at coordinated models like they have in other parts of Georgia. There's one in the Three Rivers, so kind of the Griffin area southwest of Atlanta, the Coastal Regional Commission, and the Southern Georgia and Southwest Georgia regional commissions all have varying degrees of coordinated systems where multiple counties pool their funds together and create one transportation system that services those multiple counties. in which case provides the opportunity for them to make transportation trips across county boundaries where they would not otherwise be able to with the individual county services. So coordination can be a lot of different things. And I think we're interested to hear how interested is this region in coordinated services. Would you be more interested on kind of the one-stop shop or maybe a one-stop call center or, something like that? Or are you interested in a multi-county operation where several counties come together and try to operate together?
Hey, Kirsten, I'm going to add to that Oliver says to take advantage of some of the funding opportunities, we need to find partners, and that can be a challenge, and then write the grant application.
Yeah, I think those are great comments. So partnerships, what other agencies, organizations have a vested interest and you could leverage to pool together local match funding for those grant opportunities. I think one of the comments we heard earlier about youth apprenticeship programs and providing transportation to those, that could be one of those opportunities, partnering with the private sector to help open up their labor pool and their apprenticeship programs to younger adults who are looking for employment. So if there was a grant program that was focused on workforce transportation, especially younger workforce transportation, then maybe that's one of those partnership opportunities. I also really like the idea of grant writing support. We heard in other workshops that just the general reporting of the NTD, the National Transit Database, and all of the additional reporting that's required through DHS and DCH, if you provide those services, can be very cumbersome, especially when you have a limited staff. So one of the suggestions was some sort of program support to help with reporting. I think this could be another one. Is there an opportunity for you as a transit provider to leverage some state resources to provide grant writing support? And so maybe that's a statewide program where there's a set aside of funding. People put in their projects that they'd like to apply for, and the state could, make some selections of which ones that they can help and can cover the cost of that grant writing support. That could be something. So those are the types of programs and projects we want to look for. If you say, hey, we need X number of vehicles and vehicles is our number one priority, then we want to make sure we include that recommendation in the report as well. So I have a couple final questions. Again, if you have any comments on coordinated services, we would love to hear them. These are some other needs, maybe they're administrative, but are there other gaps in service that you would like to try to fill? Do you find that you're having to charge a cost to the riders to cover your operating and maintenance costs that is now to a point where it's high enough that it might be preventing additional ridership? So the cost to ride, is that increasing for you? And are you seeing a decline in ridership because of it? That may be hard to correlate right now because we're seeing a lot of shifts in transportation ridership due to COVID impacts. But maybe it was something pre-COVID where you were seeing your costs for operations increasing and you were having to increase your fares. We talked about operating administrative needs. Are driver shortages an issue for any of the providers on this call? Everybody has drivers and vehicles, new vehicles. How about vehicles? We've heard from other regions that they put in orders for vehicles, but because of the supply chain impacts over the last couple of years, their vehicle delivery has been delayed. And now they're pushing, 500,000 miles on some of these vehicles. They're having to go in for more maintenance. They're being taken out of service. And that's causing them a lot of constraint, a lot of heartburn. Any similar experiences in this region? Jaquita, do
We
you
have
mind?
one comment.
Yeah.
Yeah, we have one comment that says, I have heard that it is not drivers, but the availability of driver hours. Drivers would like to drive more hours on our rural services.
Okay, so you have drivers, but they're wanting more hours. Um, it's hard to give them more hours when that just adds operational costs. So I think that gets back to how do we provide our existing service for more hours during the day or more days during the week? Okay. The last question I have here, and I do hope that we get some responses. If $1 million just dropped into your lap tomorrow, how would you spend it? Where would you put that money? Could be on anything.
This is the quietest bunch we've had so far. I can't believe we really want to hear from people and they're kind of quiet. So let's go back to the chat box. We've got a comment here from Oliver. Thank you so much, Oliver, for being so interactive and participating with us. We really, really appreciate it. Oliver says microtransit services, electric vehicles, and marketing rule services. Again, that's microtransit services, electric vehicles, and marketing rule services. Thank you, Oliver.
Thank you. So Oliver, I'm not trying to pick on you, but I do have a couple follow-up questions. So when you talk about microtransit service, are you referring to like a mobility on demand where, people can book a ride through an app? It'll pick them up at their destination and take them wherever they want within that microtransit district. Okay. Very
He
good.
said
Thank you.
yes. Mhm.
The reason I asked that is we've had some conversation about other mobility on demand services that are more of like flex schedules, um, or flex routes where they have standard routes, but if somebody books a ride, they're allowed to go off that route and then get back onto the route. So I just wanted to make sure that we understand the difference.
And then Christine said driver and equipment. Then we have Samuel, who says workforce transportation, major employers, technical college, dual enrollment from high schools.
Okay. That's really helpful. It sounds like I've heard, workforce transportation a couple of times in this region. Sounds like that's a major gap in service for River Valley, that in order to um, support more economic growth and jobs, need to have reliable transportation services to those jobs and to the technical colleges, to dual enrollment programs between the technical college and apprenticeships. Um, so I think that that's probably been one of the more unique needs that we've heard from the regions. I saw one about electrification of vehicles. I know that that's typically something that urban transit providers are more interested in. It can be a little difficult for these rural transit providers, especially these rural areas that have large geographies for electrification. But I think that's a great comment, and I think that's a trend that is kind of sweeping the U.S. right now, and a big focal point for the U.S. Department of Transportation. I know that there are new funding programs for electrification of vehicles that are going to be coming down through the bipartisan law. So definitely something we want to focus on in this study as well. Okay. Any final questions, comments before I turn this back over to Matt to wrap things up? Yeah. Dana.
I'm just kind of curious what you've heard in the earlier workshops from the other regions, and how does it compare to what you're hearing or reading from Oliver here? But you know, Augusta's working on a grant for electric buses. I've been riding some of their electric bus visits. They're fun.
Oh, good. Electrification is kind of a new one. I haven't heard that too much. We've heard more programs and more funding to pay drivers more. The need for vehicles, which I'm not sure how much we can actually influence until we get some of the supply chain issues solved. We did hear about the NTD reporting support and having resources to help agencies with their reporting needs. A directory of available services for each region, which I know some of them do have a directory on their website, but a statewide resource that you can go to, and for each region, you can have contact information for all transportation services. We've heard the needs of wanting to do marketing campaigns, branding campaigns, wrapping vehicles to make them more noticeable, and maybe kind of advertise that they're available for everybody and not just specific groups of people. We've heard just the need for more flexibility in service, whether that's through microtransit, through flex routes, or just removing the barriers of being able to travel across jurisdictional boundaries. We've heard things like automated notification systems, whether it's through text message or phone calls, to notify regular riders of service disruptions or having to close due to weather events, or having an automated system where people call in and they can get general information about the transit system rather than having to talk to a live individual. What else, Matt, have you heard? Going through all my notes.
And that covers, we've heard, as you've heard, we've heard a wide range of issues. We still have a few workshops to go through this week. We end on Thursday. I think hearing some of the discussions today about some of the workforce mobility issues is something we've not heard yet, but something that other regions have identified. A few other planning activities. I know that there are agreements between major employers and rural public transit operators to provide a certain number of trips for certain times of the week. We've definitely heard the issue of the service not being extended for the certain times or on weekends where riders may need it. So that availability of service is definitely something we have heard before. Are there any other questions or discussion topics we want to address today? If not, again, I'll provide my email at the very end of the slides here, but just want to give everyone one last opportunity to submit a question or ask a question while everybody is available to answer. Okay, well, to review our schedule one more time, we are working on the existing conditions assessment and the alternatives analysis now. This information from the workshop will be used for those documents. And we will start the development of the draft final report in the coming months. We are targeting July for publishing the draft final report on our website for that public comment period. Once again, I want to thank you so much for your participation in today's workshop. Please do not hesitate to reach out to me with any other questions or comments on the information we shared today. Also, we ask that you complete the survey, whether you are a provider of RHST services or ride on those services. We want to hear from you. If you're on the phone, you can find the surveys at www.dot.ga.gov/transit. And my email is mawilson@dot.ga.gov. And we ask that you send any questions by March 4th, so we have time to respond and note those questions. With that, I want to thank you all again for your time, and have a great morning.
Thanks, everybody.